my name is Kiki and I'll be your healthcare provider for today. What are your names?
Hi, my name is Abby and I have ulcerative colitis.
Hi, my name is Paige and I'm Abby's caregiver.
Great. So I am here today to educate you both on ulcerative colitis. Do you have any symptoms you are noticing?
Yeah, I've been noticing a lot of weight loss as well as very frequent diarrhea.
Those do sound like symptoms of ulcerative colitis. Let's go over what ulcerative colitis is first. It's a type of inflammatory bowel disease and is a progressive condition of the rectum and colon mucosa. So in other words, the ulcerative colitis starts at the end of your GI tract, your rectum, and it slowly moves its way up to the lining of your large intestines. The surface lining of your large intestines becomes very inflamed, and as time goes on, may lead to erosion or even necrosis of the colon. This is what leads to blood in your stool.
So what caused this in Abby?
So we can't 100% know what caused this in Abby, but it's thought to be caused by a genetically associated autoimmune state that has been activated by an infection. So in other words, if you have certain genes, an infection might set off a chain reaction in your body and your own immune cells start attacking your GI tract. It may also be caused by environmental factors like how stressed you are or diet or even medications you take.
Is there anything we can do to help with her symptoms?
Yes, there is. Abby is losing weight because her large intestines are unable to absorb nutrients due to the ulcerative colitis. So to help with that, Abby can eat a high-calorie, high-protein, and high-fiber diet. Ulcerative colitis is also characterized by remissions and exacerbations. So during exacerbations, you may notice you get worse and have periods of frequent diarrhea. During these periods of frequent diarrhea, you can use antidiarrheal medications to help, as well as drinking lots of fluids and electrolytes because you will be losing lots of fluids due to diarrhea.
Hi, my name is Abby and I'll be your healthcare provider for today. What are your guys' names?
My name is Kiki and I have type 2 diabetes.
My name is Paige and I'm Kiki's caregiver.
Perfect. I'm here to provide you guys on type 2 diabetes. Today we'll focus on reviewing what exactly type 2 diabetes is, along with some potential causes, recommendations, and going over any possible concerns you guys may have. Have you been experiencing any symptoms?
Yes, I've recently had a combination of blurred vision, dehydration, and dry mouth, and I've also been needing to go to the bathroom much more frequently.
This does sound like an adult onset diabetes, which is another name for type 2 diabetes. Type 2 diabetes is the most prevalent form of diabetes that accounts for 90 to 95% of cases. Often though, type 2 diabetes is asymptomatic. Type 2 diabetes includes a defect in insulin resistance, which essentially means that your body cells don't respond normally to insulin. Insulin is responsible for regulating the blood sugar in your body. The result is abnormal high levels of insulin in your blood, and as a result, there's an inconsistency between the required amount of insulin you need and the amount produced by the beta cells. Insulin production will gradually decline as this condition progresses.
Thank you, Abby. I was wondering what may have potentially caused Kiki to acquire type 2 diabetes, or what may have been the cause.
The precise cause of type 2 diabetes is unknown. However, there are some contributing risk factors, which may include obesity, aging, as well as physical inactivity.
This is good to know, thank you. Is there any preventative measures or things Kiki can do to help the situation and symptoms?
Yeah. There are some lifestyle changes that can delay the development of type 2 diabetes. These may include dietary modifications such as diets that are full of whole grains, fruits, vegetables, legumes, and nuts, and it also will be low in processed foods, sugar or sweetened drinks, and refined grains. Treatment plans for type 2 diabetes often include nutritional therapy, as we've discussed previously, exercise, and eventually anti-diabetic medications or insulin.
Hi, my name is Kiki and I'll be your healthcare provider today. What are your names?
My name is Paige and I have dyspepsia.
My name is Abby and I'm Paige's caregiver.
Great, so I understand that I'm here today to educate you on dyspepsia. Do you have any symptoms you are noticing?
Yes, I've noticed I get very full even after very small snacks, as well as a lot of stomach pain while and after eating.
Those do sound like symptoms of dyspepsia. Let's go over what it is first. Dyspepsia is just the name of general pain and discomfort in your upper abdominal regions. There are many other symptoms that include nausea, bloating, and pain / burning in the stomach areas. These symptoms usually indicate that there is a more serious disease that we should be aware of.
Are these diseases a cause of the stomach pain?
Yes, so many of these diseases could be the cause of the stomach pain, but we would need more extensive testing to figure out which one is the true cause. Some things as mild as a food intolerance or some things as severe as a peptic ulcer may be what's causing this dyspepsia. You may also have a foodborne illness or just a stomach motility issue. In order to figure out what the true cause is, we would need to do more testing on Paige.
Oh, that sounds great. We'll come back for more testing. In the meantime, is there anything that we can do to help Paige with her symptoms?
Yes, so Paige might have food intolerances that are aggravating or worsening her symptoms. Fatty, high-calorie foods slow the time it takes for your stomach to empty, so it would be best to try and avoid them. You may also want to avoid highly spiced foods as they also may be a trigger. You could also keep a food diary to keep track of what you eat to see if any specific foods may be triggering you.
Hi, my name is Paige. I'll be your healthcare provider for today. Who am I meeting with here today?
Hi, my name is Abby and I have hypertension.
Hi, my name is Kiki and I'm Abby's caregiver.
Nice to meet you. I'm here to educate you on hypertension and the go-abouts. Have you noticed any symptoms?
Yes, in fact, some symptoms I've been having is shortness of breath and chest pains.
You definitely are experiencing symptoms of hypertension. Let me explain hypertension to you briefly before I get into the more details. First, hypertension is known as high blood pressure. This is where the force of blood is pushing against the artery walls and it's consistently too high. Over time, this can be very serious and cause serious medical concerns like heart disease or stroke. Do you, Kiki or Abby, have any questions?
Yeah, how does one get hypertension?
Hypertension can form to many reasons. Lifestyle choices, genetics, underlying medical conditions all play a role for hypertension. Lifestyle factors include unhealthy diets, lack of physical inactivity, smoking, excessive alcohol abuse can all contribute to this. Genetics is run in family history and it's important to know what is passed along through each member of the family. If this is a common factor in the family, it is important to know how to treat this.
How can we prevent this at home?
Try to increase potassium-rich foods in your nutrition diet. Foods such as bananas, spinach, and sweet potatoes are all good recommendations to help balance out sodium effects.